Hi, I'm Ginille, cosmetic nurse practitioner since 2013. Here to answer your questions, Botox fillers, skin treatments, hair treatments. So jump in, let me know your questions. I've got 3 offices, Jasi Skin and Wellness, formerly Ginille Beauty Aesthetics. 2 are in Los Angeles, 1 is in Mar Vista, 1 is in Torrance, and then 1 is in Summerlin in Las Vegas. So please feel free to ask me your questions as you're jumping in. In our offices, we really focus on natural looking aesthetic outcomes, making sure that treatments are going to be safe for you. We treat all skin types, all skin tones, and the people who look like themselves, they just look refreshed. They're seriously aging backwards. Really focusing on skin health and hair health. I tell my patients, I'm like, I just want you to be able to walk out and not have to wear makeup. You need to wear sunscreen. Wear makeup if you want, but like, I want your skin to shine through. And the skin is the foundation. That's the biggest thing that we want to promote in our office is like healthy skin. I tell patients, even if you never want to do Botox, filler, skin treatments, at the very, very, very least, you need to be wearing your sunscreen to protect against skin cancer. It also helps just fight against signs of aging, like fine lines, dark spots. So that is an easy step in your routine. Wear your sunscreen, reapply it. All skin types, all skin tones need to be wearing it. If you can do a second step at nighttime, I want you to use a retinoid. That helps with skin cell turnover. So fine lines, pores, skin texture, dark spots, acne, collagen stimulation. So those are easy steps you can do at home. In the office, we have treatments, again, safe for all skin types and tones. We have aerolase laser, we have skin pin microneedling, bio repeal chemical peel, and hydrofacial. In our membership program, you come in on a monthly basis. We choose different skin treatments depending on your skin concerns and your skin goals. These treatments can be combined. And so some people are stacking like 2 to 3 treatments in a single session, whereas other people are just coming in if they're like really focused on whatever. We treat a lot of acne, a lot of dark spots or hyperpigmentation, and then just overall skin rejuvenation. So for acne, I really recommend the aerolase laser and or the bio repeal chemical peel. Both of those are great for killing bacteria in the skin, turning skin cells over faster, helping reduce inflammation in the skin. They both have no downtime, which is so nice. The chemical peel is not like this sheet peeling peel, so you can get back to life nice and easy. It is gentle, it's effective. I say do this twice a month, once or twice a month, depending on your skin concerns, your goals, and how you naturally start. Did I do anything to my nose? That's the only thing I haven't done. My nose is pretty wide naturally. I'm Filipino, I'm black. I haven't done my nose or my lips, but I've done everything else: under eyes, temples, cheeks, smile lines, corners of my mouth, chin. So this is me prior to doing any treatments. This is 10 years ago. After my first child, I now have 3. I have an 11-year-old, a 4-year-old, and a 2-year-old. I'm still breastfeeding. So as I'm getting older, we should be seeing more signs of aging, more volume loss, especially because I'm breastfeeding. But I've been doing the natural filler the past couple of years to just maintain and help stimulate new collagen. Treating all the normal areas that I treat, like I said, my eyes, my cheeks, smile lines, corners of my mouth, my chin, my temples. Instead of doing it with filler, I haven't had any filler for 3 years. I've been doing the natural one. So the natural one is, I think she said it's perfect. That's why I asked. Oh, that's so kind. I feel like my nose is kind of wide. Sometimes I'm like, shoot, should I do some filler there? But it looks like my kids. And so I'm like, okay, I'll keep it. And when I'm pregnant, my nose gets really, really full. So I'm like, what if I get pregnant again? I don't know. The nose I haven't done. The other treatments I really like. I still feel like I look like myself. I really feel like I focused on skin health as a big thing besides the natural like aging and like the volume loss. Volume loss was a big one for me because I breastfeed all these babies I've had for 2 to 2.5 years, and they literally sucked the life out of me and the fat out of my face. So without having to look, this is not even that bad. I have other photos where I felt like I looked even more hollow. That's when I really started wanting to do skin treatments. So here you can kind of see my hair is curly, I'm smiling, but I had like way more like sunkenness underneath my eyes. My volume loss for the cheeks, the temples were the other spots that I noticed. So the natural filler, I know a lot of people ask and they want to know, what is that? That is where we draw blood from your arm. It's made entirely from you. So draw blood from your arm. We spin it in the centrifuge and it separates out your growth factors, your stem cells. We take that part, we heat it, and then we cool it, and so it makes a gel. We can inject this anywhere in the face. Wherever we inject it, it's going to make new collagen over time. This is not the same like instant effect that you can get with filler. Filler, you can get like immediate results. With this, it's a little more subtle. Gradually, it improves over time, where the areas that you inject, they just don't look so sunken, so hollow. New collagen, things just look a little bit more lifted. It can take up to 6 months to see the full effect for new collagen, so that's something to keep in mind when you're planning these treatments. Like, do I want to see it instantly? If I want to see it instant, I'm going to go regular filler. If we're okay with doing a little bit gradual, maybe a little bit more subtle, that's when we're going to go with the natural filler. Some people are doing both. So some people are going to do not in the same session, not in the same area. You can do it in the same session, but just not the same area. So some people are like, hey, I want to see the instant effect because I want, this volume loss is bothering me. I want to see it right now. And I want to maintain it with the collagen, the natural filler. Other people will be like, I want to start with the natural one, jump start on that collagen stimulation. And then like, if it's not lifting enough, then they can decide if they want to do filler. So I've done both. I love them both. I don't know if I'm going to go back to traditional filler. I really like the natural one. There's not a ton of downtime with it. I did it on Saturday. Today's Wednesday. So Saturday, Sunday, Monday, Tuesday, Wednesday. So 4 days later, I've got like a little bit of bruising here. I had more swelling. If I've been on live I've been on live every day since I've had it. So I had a little bit more swelling, a little bit more bruising, but it comes down really quick. Like with filler, it's a little bit more temperamental, traditional filler, where you might see little bumps for a little while. They settle, but it just takes longer. It's more swelling. It's a little bit more temperamental. So I love filler, but I'm like, I'm not seeing any spot that I need a ton of structure. I need to be super angular. So I'm going to stick with the natural filler for as long as I can. What do I have under my eyes? So I've done filler underneath my eyes. I did that. This was 10 years ago. So I did that 10 years ago. And then I haven't redone it since that time. I've done the natural filler for maintenance the past 2 years. So the natural one is the one I was discussing, made from my own blood's growth factors and stem cells. What's the cost for that? Where are we located? So the cost for the natural filler, we did in 2 sessions. We spread those 2 sessions 1 month apart. It's $25.50. That covers 2 sessions. We retreat the same areas a month apart from each other. If you want to do a 3rd session, usually like mid-30s plus, I'll say, hey, I think you should do a 3rd. Or if you're really sunken or hollow, the 3rd session is $9.50 if you do it within 3 months from your last treatment. Located in Los Angeles on the Mar Vista side and Torrance, and then in Las Vegas in Summerlin. And so I'm Ginille. I've been doing Botox fillers like as a cosmetic injector since 2013. I went to Stanford, I went to Duke. This is all I do is non-surgical aesthetic treatments, really focus on skin and hair health, treat all skin types and tones. And I can show you guys some patient before and afters just so you can see who we treat. And I have some pinned at the top of my page. Like one of the first videos there, if you watch that one, that will show a bunch of our patients. Not all the patients. I've been seeing people for a long time. We have like thousands of consented photos that patients have allowed us to share, which is really, I say hats off to my patients for letting us share their photos just so other people can see what natural looking results look like. Hey Nikki, I hope you're doing so well. Oh, Himothy, thank you so much. Okay, can you get Botox in your cheeks? No, I would not advise that. I've done it once. No, not once. I've done it a few times on one person. She wanted me purposely to like make her cheeks not lift so much when she smiles, but you don't want to. Botox is going to weaken the muscles from lifting. And so here, like if you watch me, this muscle kind of goes up. There's a lady, she was like, I don't want my cheeks to lift. I want you to stop that lifting. But other than that, that is something I've done in my career for one person. Like I said, I've been doing it 13 years. In general, no. What people are using Botox for most commonly, like around the eyes, for those lines, these little bunny lines, the frown lines, the horizontal forehead lines. We do a lot for TMJ, so into the masseters or the jaw muscles, to relax those muscles so people aren't having such bad headaches, clenching, teeth grinding, jaw pain. You can do it into the temporalis muscle as well if you're having TMJ symptoms. And then you can do it into your neck to soften these neck bands so they don't show. You can do it into your chin for like little dimpling. You can do it above your lip to prevent the lip from curling in when you smile. You can do it by the side of the nose to prevent your lip from lifting when you smile. You can do it like along the nostrils to prevent flaring. So there's a lot of spots we can do based on your concerns, but I would not recommend it in the cheeks unless you just don't want your cheeks to lift up when you smile. Tiffany said she missed the answer about the nose. I've not done anything to my nose. That's probably one of the only spots I haven't treated on my face. Other than that, yes, I've done under eyes, temples, cheeks, smile lines, my chin, lower like face shadows. And this is a picture of me from 10 years ago. And I only had one baby at that time. I have 2 more and I'm still breastfeeding a baby. So yeah, and like right now I have nothing on I have sunscreen from earlier, but nothing on my face. And like, I really just try to stress the importance to people, just like skin health. I'm like, even if you don't ever want to do Botox filler, like everybody's happier when their skin just looks fresh. And so we are really big on skin health at our office and doing treatments that are safe for all skin types and all skin tones. Everything we do in our office, we see a lot of women and men of color. Everything we do is going to be safe for everyone, for black and brown skin. And I say that because not all treatments are safe for black and brown skin. In the aesthetic industry, not everybody knows what to do with black and brown skin. So that's why I bring that up. Hey, Sweet Pea, yes, let me know your questions about eyebrows. Okay, if I get Botox for TMJ, is it true you can't lift things anymore? You can totally do it. People say they just feel relaxed. They feel like they're not having, like I said, clenching, headaches, teeth grinding, jaw pain. They're not breaking teeth. They're not grinding their teeth down. They feel better without the headaches. You can still lift and do normal things. Sometimes I'll do Botox into the neck bands, behind the neck for pain, into the traps or the shoulder muscles for pain, but I never do so much where people can't lift. How much you do really depends on like how severe someone's symptoms are, how strong their muscles are, but we never want to do so much that like they can't do their normal functions. So I think you're going to be totally fine, Inez. Okay, does Botox in the neck stop jowling if you get Botox? So you can do Botox into, yes, this neck band, this platysmal muscle. A lot of times this falls right where, this jowl is going. So when you do it here, it helps to tighten along the neck and make like things look a little bit more defined along the jawline. And when people talk about jowling with Botox, not everybody gets that. I think that's very rare. I think if you're just like weakening this muscle so much, maybe you'll see this more prominent, but it's so rare that I have anybody say that. But yeah, if you want to just like be preventative and help with potential jowling and tightening in the neck, you can totally do Botox here into our platysmal bands. It just makes the neck look a little bit more like swan-like, thinner. I don't have it right now. That's why I can see all these muscles flexing on me. Okay, let me see. I want to see if Sweet Pea answered. I want to see if she asked. Araceli said, because of you, I said no to IPL. Yes. Oh, I'm so happy. Here's the thing. It looks, Araceli, like you're Latina. Like, it's possible it could be okay, but it's not worth the risk of your face. I have just seen it on like Latina, like where they've done IPL and somebody has come in and they're like, you can see bar marks on their face. And I've seen TikTok where people were like posting that black and brown people are like, I got IPL. Somebody said it'll work for brown spots. It does work on brown spots on like white people, like just only white. But like black and brown people that have gotten burned, like 3rd-degree burns. So there's other treatments out there that are safe for black and brown skin that you can use to help with hyperpigmentation and redness, which is what IPL is used for dark spots and for redness. So, okay. Annette said, what did you get done? I can't notice it. So, this is before I did any treatments. My biggest thing I noticed that I started to get treatments is because I had like sunkenness underneath my eyes. I've had Botox. I've done filler underneath my eyes, filler into my cheeks, soften the smile lines with the natural filler, the corners of the mouth, filler into my chin, my temples. All those spots I've done filler and the natural filler. And the whole goal, guys, is like, you don't want people to know what you've done. Like you can tell them. Like, I don't mind to tell people, but I don't want it to look like I've got something done. I want it to just look like me and my patients. If I can pull up some pictures of them, I'm trying to see if I have a light because the sun is going down and I'm waiting for my kid at his practice. The whole point is for it to just look like you and to look fresh. Even as you're aging, like my patients, they look hotter as they're getting older. Some of these people I've been with my entire career, which is like almost 13 years, and they look so fresh. They look like themselves. It's not overdone. And you wouldn't be able to tell that they've done something. That's like That's our intent. That's how we inject at the office. So we're really thinking about not just like chasing a line, but we're thinking about how is the face aging underneath the skin? Where are we losing bone? Where are fat pads separating? Where are they sinking? So the way that we inject, it's going to still look like them, because we're not trying to be crazy. And I can show you again. I'll pull up some photos to show you. Let me make sure I'm not missing anything. Nikki, I think I got your question. Okay. I have really sad, Sweet Pea, I have really sad eyebrows, and I don't know, should I have Botox or threads? So if you feel like your brows are like sitting a little bit low, the muscle around the eye is a circle. It closes in like that. So when you Botox here, instead of it like having those creases, and instead of the brow pulling in so tight, it'll give a little bit of a lift. It is not like, woo, it's not like crazy like that. Even threads, I feel like I see these things online, like these before and afters, and they show like somebody like this and then like this. It doesn't stay like that. Like, that's why I think threads are misleading. I'm not like a big believer in threads at all, because I'm like, I haven't seen anybody show me consistent results all day long of a thread lift that like lasts. I'm like, I don't want to see it immediate after. I want to see it once it's settled. I want to see it 3 months, 6 months. And I haven't seen somebody that can show me that. I'm like, let me see different skin types. Let me see different skin tones. And I haven't seen that from anybody. Or if they have some good thread photos, they also will say, and we did Botox and filler. And so I'm like, did the threads do it or did the Botox and the filler? So that's something in there. Gigi says she's the best out there. Head to Santa Monica ASAP. Thank you so much, Gigi. I hope you're doing so well. Great seeing you. Okay. Okay. Max said, Pamela said, I know I need it. Mac, where did you get that shirt? Somebody sent me this. I know, and I wore it for the first time today, and I was like, this is pretty cute. I never like have anything that says Botox on it, so I'm usually just in scrubs. Okay, do you have any peers you can recommend in Paris? No, I do not. Off the top, I do not. But Inez, the things I tell people to do, I'm like, do your research. Don't just test stuff on your face. Like, really research who you are seeing. You want to read their reviews, look at their before and afters, do a consult with them, like know about them, make sure they're obviously licensed to do what they're doing. And the licensing is going to be different from here in California. It's even different in Vegas, but where you are, those are the biggest things I'm going to say. Like, look at their photos, have a conversation. If you're questionable, if you're not sure, don't do it. Like, just wait and do your research. Don't rush things on your face. I feel like when people do that, they make mistakes and they're not happy. And so I'm like, I don't want you to do that. Okay. Are you able to treat mid cheek crease with Sculptra? Hey, Austin, Augustine, you can. It's going to be subtle to make new volume there. It's not going to give like a lot of contour, but it can help with some volume loss gradually over time. Where's the office located? We are in Mar Vista, Torrance, and then in Summerlin side of Las Vegas. So I've got 3, and I see patients out of all 3. The offices have been under my name since 21. I've been doing this since 2013, but in 2021, I started in my own office. So it's been under Ginille Beauty. The past month, I just switched it to Jasi Skin and Jasi Skin and Wellness. So you can look under my name, or you can look under Jasi, Jasi. So we just switched the website over last week, and we're still making edits to it. But if you ever have questions, you can call or text the number at the top of my page. My team is on that. I see all the messages that go through. We don't miss one. We're on it. You can send a DM. Just sometimes if I'm with patients, I might miss it. And so that's why I tell people, I'm like, if you text the team, it won't get missed, because we have people on the phones. You can also set up a consult at the top of my page. So I do virtual consults, and I also have my team members. They do virtual consults where we talk one-on-one. We go through your questions, your goals, tips on what to expect, how to prep treatments. If somebody's like, I want to do this, we're going to have a series of questions before we can decide if this is the right treatment for you. We have to make sure you're a candidate for it. Make sure you understand expectations, limitations with it. So we go through all this stuff before you even come in. Then we send you information about everything. We send you pricing. There's financing if you want. But our patients that come in for treatment, they are prepared. They're not wondering, because we've already talked about stuff. We've sent them the videos. We've sent them things to read on it. they are informed. We're not making rush decisions. I don't want people being like, oh, I don't know, should I do it? If you're thinking that, I'm like, nope. The answer is no, don't do it. Like, there's no rush. I don't want you ever feeling pressured to do this stuff. None of us need it. I'm like, no, you're beautiful without it. But yes, do I know how it can make people look and feel? Yeah, I totally do. I know it can make people look and feel refreshed and more confident, and just like they can show up as their best selves. So I'll flip through a few photos and then I will check through some pictures. Let me make this bigger if I can. No, not me, the photo. Okay. I can talk. These are just, I like to show some of our patients, and these are ones I just have like set up on my phone, but we have way more patients. But I just want to show you, like, again, all skin types, all skin tones, they look like themselves. They look refreshed. If you just look at the after, you wouldn't think this person has done Botox, filler, skin treatments. And that's the whole goal. Like, it looks like them, never overdone. You know, somebody earlier was saying, Ginille, I can't tell. What did you do? I'm like, cool. Like, that's the point. Like, I've done a lot of things and I've definitely aged and my weight has fluctuated with pregnancies and breastfeeding, but I still feel like I look like myself. That's the goal, is like, we want it to look like you, not somebody else's face, not morphed into, you know, I feel like a lot of people will start to morph into each other, just in aesthetics. I'm like, you don't want that. Like, we're not trying to have the same features. Like, people have different noses, obviously. And so we want it to look like you. So these are just some of our patients, and I shout out to them again for sharing, allowing us to share their beautiful before and afters, just so you can see what natural looks like. A lot of people don't know that Botox and filler can look natural. Okay, let me read through some of these. Would I ever open up a shop in New Jersey? My maybe. New York is the one I get asked about the most. New York and Houston. So New Jersey, close there, right? Okay, I got filler for the first time 2 weeks ago. I see some results, but not dramatic enough. So don't rush it. Like, when you do this stuff, it's better to add. You don't want to go too crazy. Do it. Let it settle. 2 weeks is still settling. 6 to 8 weeks for it to completely settle. Then reassess and you can do more. Biggest things are talk with your provider, go through goals, expectations. When I do stuff with patients, so like you can see here, this is before, this is her after, like when she settled. I do, like, again, I'm like, let it settle, reassess. We can always do more. We just don't want to overdo. That's when people start making their faces look weird. They're trying to rush to get to the treatment. You got to think, like, your face didn't age overnight. Don't expect these treatments to, like, do it all in one. So I always tell people, like, I expect to see you at least twice. Do it, come back, let me see you in 6 to 8 weeks. If it's perfect, cool. If we have to add some, we totally can. I give a range out when I'm like, hey, I think we'll talk about whatever parts of the face is. I always give a range. I'm like, hey, I think it's going to be about this many syringes. I tend to start on the lighter end. I want to get to the point where we can all see a difference and appreciate, like, they can see it right then and there. We can see the difference. Then I say, okay, let's pause. Let this settle. Because when you're doing your injections, you can bruise, you can swell. So it gives a little bit of a false perception. So you want to come back to where you can fine tune and do more if you need. But the biggest thing is don't rush it. So that's just one thing I would say there. Sweet Pea said, I'll be seeing you, girl, because I love your choices and sensitivity to us brown girls. Yeah, and there's not a lot of people that are mindful. Like, it's different, and like the features are different on everybody. So I want to be mindful to that. Do I offer facials? Yes, we have hydrofacial in our office. We also have the Bio Repeel chemical peel, Aerolase laser, and skin pin microneedling. So those are nice because you can combine, like, if somebody, depending on what their skin concerns are, we can start combining it. So a lot of people will come in and do the laser, the chemical peel, and the hydrofacial all in one day. Just depends on what their concerns are, and then we kind of decide, here's a treatment plan. Okay, I'm trying to still go through and make sure I'm hitting them. What's the longevity on PRF? Hi, Sweet Pea, thank you so much. Mid cheek crease and nasolabial folds are my biggest concern. So PRF, not overnight. When you do this, this is one made entirely from your own bloods, growth factors, and stem cells. When you do it, it's going to give a little bit of lift. You can see immediately. It's going to kind of settle down after a couple of weeks. It's going to look like you didn't do too much. Gradually, it gets better. So similar to sculpture, I think, Augustine, you were asking me earlier, it gets better over time. This is not, if you are like, you want like more structure, or if you want to see it quick, that's when I start talking about doing filler. When it comes to filler, we can choose different ones depending on your goals, depending on how thick your skin is, or the areas of the face that we're treating. So some are going to be more structured, some are going to be softer. So depending on what you're trying to do is how we decide which treatment, which filler. But PRF, with the whole purpose of that is to get new collagen wherever you inject it. New collagen can take up to 6 months to see the full effects, but it can last for years. So that's really nice, because as we get older, we're gonna keep losing collagen. And so people will notice like, hey, my face, I'm getting these lines, like things don't look as lifted, as youthful. So we want to have some sort of way to make new collagen. Another thing to keep in mind, younger, healthier patients are going to have better outcomes. So if you're smoking, drinking, drugging, have a poor diet, like all those, and 65 plus, I'm like, all those things, like your body's not going to have a great environment to make new collagen. I really like the natural filler. I will tell you, when I first did it, I was like, I don't see any change. This didn't do anything, because I'm used to the instant effect of filler. I mean, like right when I did it, I was like, oh, I look lifted. A couple weeks, I was like, I don't see any change. Over time, it gets better. Now, not as structured, if somebody's like, I want to be snatched, then I might need to use a more like structured filler. So all this is kind of why we got to assess. This is why we got to make sure it's right for you, see your face, and just talk about your goals. Everyone's kind of different. I had multiple calls today. Some people were like, I'm seeing this line right now. I want to do it right now. I need to see the result right now. I don't want to wait. Other people are like, hey, I'm just kind of trying to be more preventative. I want some maintenance, and they're okay with going a little bit slower. So that's when we might go PRF. So every conversation is different. Every face is different. And we just have to build out the treatment plan for you and see what's going to be right. Okay, do you map out treatment plans or do consultations for suggested treatment? Sweet pea, yes. So this is why we'll do them virtually and then in person. So virtually, I can get a pretty good idea of what your treatment plan is going to be. I've just been doing virtual consults since we had shut down in 2020. And I'm like, hey, based on all these questions, based on what we're talking about, this is what the plan is. We start to write it out. Like I said, that's where we can send you information. We can send you pricing and all of that. And then I say, obviously, when I see you in person, let me feel on you. And then, it might change a little bit, but for the most part, the treatment plan is pretty consistent from what I see on camera and then in person. Yeah, sometimes if there's something where I'm like, hey, you don't have good lighting right now, or you're like, camera's fuzzy, I might be like, I need you to send me photos and I need you to send it to me in this lighting. That's the only thing. But I do the consults all the time virtually, and they serve us really well. They serve their patients, most importantly, really well, because they're just prepared when they come in for their treatment. We've already discussed, like in their mind, even mentally, they kind of know what to expect, and they're not coming in like, oh my gosh, I'm about to get a needle and what is going to happen, and da, da, da. Like they already have information before they come in. Plus, I put all this stuff out online, and I try to, answer questions here, and I try to show patient before and afters so they can see. Okay, I'm trying to scroll. What do you recommend for broken capillaries around the nostrils? Laser. Yes, the Aerolase laser works well for that. And safe for all skin types and tones. When we do that, we do a little bit higher energy and a little bit more focused and targeted, like right on the blood vessels, on the little broken capillaries. Okay, what do I think of BBL facial treatment? I wouldn't do it on black and brown skin. Okay. Let me go back down. Do you feel like it's too late for Botox in the 40s? No. I will say, and I have some pictures on my phone, but I've got probably 100-something thousand photos on my phone. So I have to set these up before I come on live, and I only set up like whatever, these 20 here. But I have somebody that came in, she had really etched lines. And like, even when she wasn't smiling, she had deep frown lines, deep forehead lines. Like him, he's flexing. But her lines were basically looking like that, even if she wasn't frowning. And she was like mid 40s, and she was like, I've never done anything. I'm super expressive. I was like, even if she wasn't making a face, you could see like deep ones just etched in on the skin. And I told her, I was like, hey, because those lines are like really etched, I don't expect your forehead to ever be like completely smooth just because it's happened over time. I will smooth out a lot, but she still had like faint ones. So, if the lines are really deep, they might not go away, but 40s is not too late. I'm like, it's okay. Like, just do it. How much Botox you do really depends on how strong your muscles are, how big the area is that we're treating, and then what you want the outcome to be. So some people have like a really big forehead, they're going to take more. Some people have like really strong muscles, they want to be frozen, they're going to take more. I have other people, I'm an actress, not me, I'm an actress, but I want to soften my lines so they're not so mad, but I still need to have lines, we're going to do less. So it's again going to be like consulted based on your face. We kind of have to like, hey, let me see you express. And then when we're talking, I'm kind of like watching, I'm looking at like little minor asymmetries. I'm looking at how you hold your face. Some people, like when they talk to me, they're like this kind of the whole time. They're kind of like opening their eyes up. So they're using this forehead muscle a lot to like raise their eyebrows. So in my mind, I'm thinking, okay, if I make this like really strong or frozen on that person, it's going to feel hard for them to open, and they're not going to like that. So these are things that are like going through my head when we're doing the assessment. And it's not like I'm trying to think about this. It's just like what I do. I've done this for work since 2013. So my mind and my eyes are like in assessment mode, especially if we get on a call and we're like trying to talk through something. Okay. Let me see if there's other ones I have missed. What do I think of Aqualex? I think somebody else was asking me about that. That's not something that we have in the US that's FDA approved, so I don't really know about it. Virtual will be a great start. For Sweet Pea, yes, you can totally book those online at the top of my page, and we can go through those one-on-one. And then let me see if there's others. Sorry, I'm trying to scroll. There's some procedures I'm stuck between surgery or Botox or filler. Do you advise on that? Yes. So I will tell you everything I know about Botox filler. I will tell you if I know anything about surgery, but I'm not a surgeon. So I highly encourage my people. I'm like, do all your consults. Like, I'm not ever here to be like, yeah, just do Botox, just do filler, like avoid surgery. That's not it. I want you to make informed decisions. So I say, I want you to go do your consults for your surgery. Like, just get the information and then decide. Some people will tell me straight up, Ginille, I'm never going to do surgery at all. Like, do what we can do. I don't want surgery. Other people are like, okay, like, I want to have the conversation and decide. Because I'm like, you may decide that that's what you want, or that could get you better results. That's the biggest thing for me, is like, you can make the informed decision that's right for you. I will give you everything I know. I will tell you what to expect. I'll tell you limitations. I'll tell you like realistic, hey, I think this is for you. I will show you pictures of somebody that reminds me of you. I'll show you pictures of like different results, but I'm not going to be like, yeah, do this, only do this, skip surgery. People have different reasons on what they want. Like for me personally, everyone's things are different. Some people are like, I don't want to have to, do filler and maintain it. I just want to have surgery. I'm like, okay, just ask about surgery. Like, ask them and learn more, because it's, surgery is not always one and done either. So we just talk through it. But yeah. Okay. What's the name of the natural filler that you use? So it is made entirely from your own blood. If you look on our website, it's called Easy Gel PRF. Easy Gel is just the name of the heater and the spinning system that we have, the little centrifuge. But in general, the whole system, you can think of it as like a bio filler, basically made from you. It's the heating and the spinning and the heating part that makes the gel, and just your body's growth factors and stem cells. I tell people, I'm like, take your vitamins, be healthy, eat a healthy diet. All of that is going to help you have a better outcome. I'm trying to, the picture shown, is that for PRF or fillers? That was going to be for filler on there. And then, okay, can I fix my nose with filler? Perhaps. Let me see your nose. I'll show you a couple noses, and I'm going to go because my husband was calling me. I think I got to do something for my babies. So here's some different noses. With the nose, we can camouflage a bump. She wanted her nose to be really straight. I mean, I feel like this is a surgical result without having to do surgery, and it didn't take me long to do. Now, she did this over 3 sessions, so we spread them a couple months apart, but like, no downtime. She was able to see instant results. For her, she had like a little bump, and she wanted her nose to be up. People will tell me they want it to be up. They want it to be straight. Some people want to keep some of their bump. All these different things, we can customize it. She had it, so it doesn't have to be straight. It doesn't have to be turned up. It can be what you want. If there's like a limitation, I will tell you. If I'm like, hey, like I can't get it. Some people, like, turn it more up. I'm like, oh, I can't. There's limitations with how much your tissue will allow us to move. But she wanted to fix a little bump. From the side profile, people were really just like, they're able to see like the little bumps straighter. Her nose tip kind of went down. She wanted to be more straight and up. For her, when she smiled, her nose curved down. She wanted to be turned up. I do it on guys too. From the front, we can create a highlight down the bridge, make things look a little bit more contoured, defined. It won't make the nose smaller, but making that highlight, girls will be like, hey, it looks like I did my makeup, like I contoured my nose. So that is really nice. Good evening. Thanks for the live. I tried to make an appointment, but I only want you to do it. Okay, happy people, let me know. Text the team and they can help you with all of that. So let me know through there. Hi, Brown Eyes. I hope you're doing so good. How long does it last? If we're talking about the nose, I tell people 1.5 to 2 years. A lot of people get longer out of it. I know this girl came into me at her 2-year mark and it was still completely straight. And I was like, what do you want? She's like, I don't know. She's like, should I do it? I was like, do you see a change? She's like, no, but like, I want it to stay that way. I'm like, it's staying. Let's leave it. For her, we haven't redone it. We did those 3 like back to back and it's still, this was years ago. And like, it looks really nice. So yeah, people like that. Okay. I am going to jump off just because I want to check on what's going on with my family. If you have other questions, you can call or text the number 424-218-4023. That I see all the messages that go through. My team is on that as well, and they can help send you information, pricing. We try to be super transparent with everything, guys. I don't have anything to hide. Like, I've been making videos saying the same stuff for the past 5 years. I've been doing this since 2013 as a cosmetic nurse practitioner. We've got 3 offices. 2 are in LA. 1 is in Torrance. 1 is in Mar Vista. And 1 is in Vegas. Our newest is in Vegas. We've got team members in all of them. We treat all skin types, all skin tones. I can't wait to see you. I went to Stanford. I went to Duke. I'm not playing around when it comes to your face. People be like, oh, you're a Virgo. Like, I don't even know that. But like, that just means you're like, I try really hard. Like, I want to get excellent results. And that's just the standard, period, at our office. And I think that's so important when it comes to your face. Like, I don't take this lightly. We're not playing around. We're going to get you a great result. But anyway, we can set up consult time. We ask us any questions. Do I have the Bay Area? Not right now, but we see people from the Bay all the time. Every time I'm in clinic, guys, I see somebody from out of town, out of state, out of country, like all the time. Wyoming was yesterday, like every single time, New York, everywhere. So, but we really prep and we plan and we talk through it. We're like, we make sure that you're ready for all the things. We make sure it's a good timeline for if you've got events going on. So Bay Area, we see people from the Bay all the time. Okay. If you think of anything, please let me know. I hope you guys have a great night. God bless you. Always send your questions and I will talk to you soon. Have a good one. Bye.